Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hello. Happy Thursday. Also want to remind everyone that we are going to be in upstate New York at the Rhinebeck at Omega Institute in July 18th, 19th, and 20th. So if you wanted to come meet us in person, we would love to meet you there. We always like to give little shout outs or like to celebrate members' achievements. And so we've started doing shout outs. So this week, want to give a shout out to who started the program at 62 out of 132 and in 6 months was at 12. So that's a huge drop. And then a shout out to who started the program at 74 and in 22 days was down to 19 and is now fully recovered. She stayed in the program in our maintenance program to be able to continue to participate in the seminars, and so that she really enjoyed all of the live events. So shout out to both of those members.
Thanks for sharing with us, Nikki. It's always nice to hear.
And we can go.
Hi, my question is there, let's see if I can put it into words. My question is there a relationship or a correlation perhaps between concussion and neurodiversity? So I'm wondering, sometimes there can be like mental health challenges and people can perhaps have more of symptoms of a concussion when that happens. And I'm wondering if you know if there's a correlation with it also, because lately I've been taking lisdexamfetamine dimesylate. I'm not sure if that's the way to read it. I'm taking that for ADHD, and it's really helped a lot as well. So I just wondered if you have any thoughts about that, because I'd like also to not be on the medication forever, but for now it's helping. So thank you.
Are you familiar with that medication, Paul?
I didn't quite catch the name of that. Can you type it in the chat just so we understand exactly what we're talking about? I mean, I can make a couple of comments in general, and Melinda, I'm sure you will as well, because this definitely overlaps with the type of patient you might be seeing. So let's look at this here for a second. A lot of people struggle with focus issues, concentration, memory, productivity after a concussion. And this can be a product of the symptoms they have. And many times, in my experience with patients, I've noticed that if they have an underlying predisposition to any sort of attention issues, whether it's ADD or ADHD, that can become aggravated in PCS. So it kind of gets exacerbating, meaning symptoms get worse. Also, it's important to consider that a lot of these symptoms are a product of the symptoms you have from PCS, and actually may fit even the diagnosis of something like ADHD, but really are a product of the persistent symptoms. There's a lot of overlap between neuroinflammation, the sensory processing issues, the increase in symptomatology. Again, with patients, I noticed that it really becomes clear after a person's resolved a lot of their main issues. Let's say it's light sensitivity and exercise intolerance and headaches. Once those symptoms kind of become in check, but a person hits a plateau, or they hit kind of an obstacle in their treatment recovery trajectory, that's when patients start looking at, okay, so is there some underlying ADHD? I would be cautious about jumping to that diagnosis or conclusion right away. The final thing I'll say about that is that when you look at the research around pharmacological options, meaning drugs that have been studied for having some sort of benefit post-concussion, methylphenidate, which is the main poster child for ADHD medications, aka Ritalin, for example, Concerta. This medication has some evidence to show that it does help with energy and focus after a concussion. However, it doesn't really address the root cause. It doesn't really address the reasons that we try to talk about in the Concussion Fix program, why a person's focus and energy might be off. So I think what I'm going to just caution is that there may be some sort of attention and focus issue going on. And like I said, it could be exacerbated because of past predispositions. But really, we need to see if that's left after all the dust settles, addressing all the other things I just mentioned that we talk about as part of the course. I don't know if you want to add anything to that, Melinda.
Yeah, I mean, it's a complicated picture. I've actually included a new lesson in the course re-record kind of on this topic. And even writing the lesson, it's complicated to try to figure out, right? Because there's just so many overlapping factors. So like the research shows us that ADHD makes us more susceptible to developing PCS, but also having a concussion can bring on something like ADHD. Also, if you had pre-existing mental health conditions, it's likely that's associated in the literature with developing ADHD. So there's just so many different layers. So it can take a little while to sort of figure out your individual picture. So for example, you mentioned mental health. So I wasn't sure if you had a question around there about ADHD and the link to mental health, or maybe you were noticing mental health symptoms as a result of the medication. Maybe you can kind of clarify that for us.
Could you ask the question again? Sorry.
Yeah. You had mentioned something about mental health and the medication, and I just wanted to be clear what the question was.
Yeah, so if I've seen before in literature that if there's already mental health disposition, then this can make it a bit more complex for PCS. And in my case, I've had support with anxiety and also before my concussion. So so it's like what I've been told is that it sounded like I probably already had most likely ADHD and possibly autism. And then that the concussion may have highlighted these kind of symptoms more, because it's always been very masked. I was always a very high achiever. And I think that those personality traits can also be quite interesting when it comes to PCS and all these things anyway. But it's a world, isn't it? And I guess I'm trying to make sense of it for myself, but also in terms of learning. Does that help with the question you were asking, Melinda?
It does. It does. And I think it just speaks to the complexity, and you're trying to make sense of your own experience and how you can best support yourself. Is it the ADHD medication? Is it something else? Is that right? Okay. Yeah.
Absolutely. And especially because I'm taking this because I scored quite high in ADHD from the test I did with the mental health professional, and they've given me these they're amphetamines, and I find them really quite helpful at the moment, if I'm honest. So it's interesting, and it's just difficult at the same time and complex to break it down, it feels. So any support with that is really appreciated. Thank you.
Yeah. So once we have our course relaunch, absolutely go back and listen to risk factors. That'll be a lesson that'll give you, more literature that I am not going to remember off the top of my head. But they are all interrelated. So anxiety and depression, having a history of that, or having it comorbidly alongside PCS is a risk factor for a prolonged recovery. Similarly, neurodevelopmental conditions like you mentioned, ADHD, some learning disorders, as well as autism spectrum disorder, are shown to be associated with a prolonged recovery. Now, that doesn't mean what they're referring to is unsupported or non-treated. So I think what you're doing right now is great because you're addressing each one of those buckets and trying to figure out which one might create a little bit of movement for you to support your recovery. So there isn't a right or wrong way to go about it, but I think what you're doing sounds right to me, that sense of isolating the variables. You're working with a mental health clinician. You've identified a past history of anxiety and or depression. I think you said anxiety. And getting support with that. Then what we know from the literature is that anxiety and depression can interact with neurodevelopmental conditions and create more challenges with recovery. So that foundational piece might be support with anxiety, depression, or other mental health conditions, then treatment and support with the neurodevelopmental aspects. It doesn't always have to be in that order, but from what I was reading in the literature in preparation for our re-record, that's kind of what I was gathering, as well as from our experience in our clinical practice. What we notice is that, for instance, if somebody has pretty significant anxiety, it's unlikely you'll be responding well to treatments for neurodevelopmental conditions without support for that anxiety. So thinking of it as sort of like isolating the variables and treating them one at a time. So if you've already worked through anxiety and now you're working through ADHD, great. So stick with it for a while if that's supportive for you. There is more literature on ADHD and delayed or a complex recovery picture for PCS than there is for autism spectrum disorder. So we know that much, but that's, doesn't mean that any symptoms you might be noticing with autism are impacting your recovery. But it might be choosing one and then exploring how to treat and support that. See if it helps launch you forward in your recovery a little bit. Once you feel like that's a little bit more stable, you might add in something else. So it is a little bit of a stepwise process. Does that help at all?
Yeah, it helps a lot. Thank you so much. It's what's the word? It's not comforting, it's reassuring. I think that is what it is. Because these things are like different, but then it's like integrating them, as we know, can be quite challenging. It's a lot to integrate as well anyway, even if I didn't have neurodiversity or whatever we want to call it. But that's very helpful, Melinda, and thank you both.
Yeah, you're welcome. And so one of the things we've been able to observe repeatedly through the last 5 years is individuals who have gone through the program and feel like they really implemented things well, but they were always feeling like something's missing, loosely quoted. That was when the invitation was to go back and think, okay, wait, am I missing something? Do I have, neurodevelopmental condition? Am I experiencing underlying anxiety, depression, or other mental health conditions that weren't adequately addressed and treated? And those tended to be the two main buckets that prevented someone from gleaning the insights and learning what they needed from the program in order to support their recovery. I don't know, Paul, if there was anything else you wanted to add to that, because I'm kind of just thinking generally now around our experience with Concussion Fix.
I think you summarized it really well. I'm glad that you are working with somebody that's already helping you with some nutrients to support brain function. I think this is the first place to start. I saw a patient yesterday where we were addressing ADHD. This was in kind of a younger patient. There are a lot of lifestyle factors, dietary factors, sleep, screen exposure, certain food intolerances, on top of nutrient deficiencies that at least provide the foundation. And so sometimes that is what's required to kind of allow a person to get control of some of the foundational background noise that's happening for when they're during the recovery process. And then they can start working on some of the actual PCS symptoms. I still think, I firmly believe, based on our past experiences, that start with a concussion fix pyramid, work your way through the program, and then see what happens as the dust settles. If at the end of the program you've applied everything and you can honestly, after reflection, say, I've done all these things and I still have these main symptoms, like, I'm majorly unproductive, or I can't focus, I can't concentrate, I'm struggling to get back to work, not because I'm light sensitive anymore, not because I'm getting autonomic symptoms, but because I simply can't focus and I'm procrastinating, then that's really where I suggest people start looking for extra help. That's the ideal pathway. Now, if you are coming at this with already diagnoses, then that should inform your care team on how to kind of navigate this. But either way, regardless which way you're coming from, start with a fix program, get through it, apply as much as you can, because it's going to help PCS. It's going to actually help any sort of ADHD attention issues.
Yeah, thank you so much. I just want to add one thing, which is like the sleep aspect for me has been really challenging through the years, and especially since COVID. And then forwards with that, and with, all the noises, like you're saying, as to what's going on with the world and everything like that. And sleep for me became really tricky. That's when my mental health really went through the window a bit at one point. And also with being a woman, and I'm sure you know about this, with menstruation as well, and the phases that we go through. If we don't sleep, this is just so much to deal with. So that's what kind of led me to go through also the path of support with mental health a bit more at this stage. But it's the lack of sleep, and that it really is the lack of sleep. So, and that is like the main cause. But then it's hard sometimes to still, even if I do a routine for sleep, even if I put things in place for sleep, there are still nights where I will not get any sleep. And that's really, really heavy, really difficult. And maybe I can look at nutrition and more in the program also with regard to this. Melinda's videos have helped me loads as well. But I can't put it into words how challenging that can be. So thanks, that's really helpful. Thank you. And I'll continue to do the program too. So it all helps.
Absolutely. And it is so bidirectional. I think that's the trouble, right? Is there's, maybe this underlying level of anxiety, depression, or a neurodevelopmental condition that's really been amplified since the concussion or the head injury. However, if the head injury offset that fine balance of hormones, sleep, that's also going to impact mental health. And so it is so tricky, right? And so sometimes, and Dr. Paul, I'm curious if you would agree with this, sometimes when I'm working with a client who is trying to navigate multiple different factors, it's just what's the top one, right? What's the most predominant struggle? And I'm hearing sleep. So it might be, hey, even though I know I have ADHD or potentially autism, or there's a history there of some mental health, if sleep is really disrupted, that's going to feed into all of those things as well. So it could be helpful to just think to yourself, for anyone listening that has a really more complex picture, well, what is the predominant thing that I'm really struggling with right now?
Yeah, I would agree with that. Many times PCS patients, members of this community, they feel like they have so many symptoms that are overlapping and complex. And, the biggest question I think we get is, where do you start? How do you kind of unravel all these things? And you mentioned sleep. And oftentimes in my practice, and also when I talk to people who are part of the program, I tell people to start with sleep as one of the key areas to stabilize first, especially when there's lots of other things going on. Yeah, you have all the symptoms, you have a high symptom score. Well, let's focus on sleep, because if you can get sleeping, and even if we need to use some sleep aids to do that, that is going to help with all the other factors. Your mood is going to be more stable. You're going to be a little bit happier. You're going to have less anxiety. You're going to have more energy, and you're going to have more capacity to do the things that we're asking you to do. Sleep's a great place to start. That's where it's like the foundational pieces, like the way that I eat, the way that I sleep, the way that I breathe. These are things that are like, absolutely, you have to do them. You don't have to exercise, so I will put that in the tier 2, but you have to sleep and you have to eat. So start with those things and then see how the dust settles. So it sounds like you're on the right track there. Keep up the good work. And thank you so much for your question. I'm sure it was very helpful for everybody listening.
Thank you.
You're welcome. Okay, we're going to move on to.
Hey there.
Hey.
So my question's probably for you.
Yep.
So I've had post-concussion syndrome for over a year now. I'm supposed to leave on a trip to BC on Monday. I'm a little worried about flying. I know that like everything kind of shows there's no risk to flying with standard PCS.
Mhm.
So my worry is that I haven't seen a neurologist yet to rule out things like CSF leak, for example. I know it's more on the rare side, and my doctor seems to think that's not the case. So he says I should go and I should be okay. So I'm just wondering if the small chance of having a CSF leak is enough to make me like not go, or if I should listen to my doctor and go anyway. Yeah, I don't know if you can even answer that, but
Well, I mean, there's not a perfect answer that I'll say you don't have a CSF leak. That is possible for us to say. However, what we can kind of deduce here based on your symptoms and based on what you've just shared is that most likely you don't have a CSF leak because there's a certain set of symptoms. What would you say your top symptoms are here?
so constant headache and head pressure, vision issues, and then like kind of like head throbbing, like it feels like I have a blood flow issue. Yeah,
Okay.
those are the main ones.
Okay. Usually with any sort of CSF leak, it can be very mild, and usually I've had a number of patients, even members of the course, they have said that it was found after they've exhausted all the other things in terms of manual care. They've gone through Dr. Cam's section, and no matter what they did, is that their headaches really didn't change. What's unique about a CSF leak headache is that it really changes with your posture. So again, if you're lying down, it's a little bit better. It's worse when you're standing up or you're sitting. There's a lot of there can be some vision changes, but this is actually like vision changes rather than like light sensitivity or tracking issues. So there's a differentiation there.
Okay.
There's usually a lot of like neck pain and stiffness that absolutely doesn't respond to any sort of manual care. So if you feel better after some massage, or if you feel better after acupuncture, or you feel better after manual care, that's a good sign. So I would probably err on the side that, from what you've described, that your doctor is absolutely right. CSF is really rare and usually much more severe in symptom nature here, Ethan.
Okay. Um, do you know if there is any risk to flying if you have a CSF leak?
Um, like, of course, any sort of fluid in your body is going to respond to changes in pressure. But again, I think it's hard for us to, of course, there's going to be a risk. I think it'll be a higher risk, but I think the chance of you having that is really, really slim based on what you've said. So again, I probably would say your doctor is correct in this case.
Okay. All right. Thank you very much.
You're welcome. Let's do, and then we have a couple questions in the chat after.
Hello.
Hello.
So I have a question. I'm not sure if this would be a Cameron Marshall question, or you're in charge of the sleep section, right?
I
'Cause I
do.
haven't gotten that.
Yep.
Yeah, okay. So I have had like neck pain in the past, like even before I got my concussion. And I got this pillow a few years ago where it's like it has like a depression in the middle of it. So like there's support for your neck kind of, and your head goes down in the middle of the pillow.
Yep. Yep.
Like there's a little dip in the middle. And it feels good like to sleep like that when I'm on my back. And so I just have been trying to sleep on my back for the past few years.
Okay.
But if I move onto my side, which I do sometimes, I feel like it makes my neck hurt a little bit. So I don't know. I was just wondering what advice you have for what kind of pillow to get if someone sleeps on their back and their side.
Yeah, you know what? Dr. Marshall recently just collaborated with a company that had some very specific pillow that was helpful for brain issues. You know what I'll do is I'd suggest, let me see if I can find it and I'll put it in the chat.
Okay.
Um, and I would also just message him, and if I don't find it by the end of our call today. So there is some specific pillows that can be quite helpful. Uh, in general, I think one thing that I've noticed from a clinical experience is that everyone has a different kind of preference when it comes to pillows. There's definitely some unhealthy pillows that people should be using where their neck is really flexed forward. In generally, you do want that support for the cervical spine with your head facing neutral and basically your eyes pointing straight up. So it sounds like the pillow that you're using is fitting that when you're sleeping on your back. Um, on the side, that's a little bit of a different story, but again, you need a little bit more support probably, and that's where it's hard to control that. So let me see if I can find this pillow link that Dr. Marshall sent out, and maybe that might work for you.
Okay, thank you.
I believe the company is called Pure Care, and what they do is that they do kind of like a custom pillow, I believe. A custom pillow. Let me see. It's called Pure Care. Pillowwise Custom Pure Care. Maybe I'll send you the website here if I can find it. Okay, give me a second here, Jerome, and I'll put it in the chat. Okay.
Okay. Can I ask a question to Melinda too then?
Go ahead.
For meditation and mindfulness, the course is saying like you're supposed to do it multiple, or you're supposed to like the more you do it more consistently, that's how you actually build the neural connections. So I was just wondering how often should you do it? How many times a day? Is there like a certain amount of minutes you should do it, or is it kind of not really that specific?
Yeah, great question. Of course, as far as neuroplasticity goes, the more you can do something, the more likely it is to become habitual and automatic. So it's going to support you. It also becomes easier over time to get into a meditative state or a mindfulness, present moment awareness kind of place if you're doing it often. So consistent is sort of the message that I convey in that lesson. The research shows us that as little as 5 minutes a day can create positive neuroplastic connections as far as concentration, memory, pain reduction, all these kind of things go. Now, that's for meditation or formal meditation in particular. I've found a lot of clients have benefit in even just mindful activities. So things like present moment attention to one aspect of your experience. So that might be walking barefoot in the grass and immersing yourself only in that sensation of your feet against the ground, or drinking your tea or coffee mindfully, decaf, of course. And if you are looking at more formal meditation, then that's a seated practice where, eyes open or eyes closed, you're just focusing whether it's on your breath or an anchor that's supporting you, seeing if you can do that for a 5-minute time period. Everyone is in a different place. So I don't like to say it's formal meditation practice for 5 minutes a day that's going to be helpful. It's too complex for that. But if you can, if you're not in a place where you want to be meditating, or it's uncomfortable, or your symptoms are too high to be sitting formally, or trying to focus on your breath, or your feet against the ground, maybe you're not there yet, I would recommend still engaging in those mindful activities that are going to allow you to build that skill of focused attention to one aspect of your experience. So if you could do it 5 minutes a day, 10 minutes a day, or maybe like 2 different 5-minute periods, 3 different 5-minute periods, this can be really helpful. So it really just depends on, one, if this approach in mindfulness and meditation is resonating for you, because if it resonates for you, you're more likely to do it. Some clients that I work with say, I like the movement or the somatics better. You can kind of do those things. The um, neuroplastic changes in the brain are similar, or if not the same, if we're using that skill of focused attention. So if we're focusing solely on one aspect of our experience at a time, we are going to be supporting our brain and building neuroplastic connections that will support things like focus, concentration, pain reduction, memory, that will be helpful for you. So it really is that skill of focused attention we're looking at more than the act of formal meditation or mindfulness, if that makes sense.
Yeah, I wasn't thinking about it like that, but that makes sense. Yeah, focusing on the skill. Thank you.
Yeah, yeah. So, if you're someone who's meditating, I'm not sure if you are, but if you're someone who's been meditating and that's resonating for you and it feels supportive, great. So aim to do that, in a couple 5-minute intervals. Then if it, continues to feel beneficial, maybe try to increase that to 10 minutes. But if it isn't, like, you don't want to force something that's not working, right? Mindfulness and meditation is one way to support your nervous system, but it's not the only way.
Mm. Do I have time to ask another quick question?
I think
Or
we
no?
do, yeah.
Yeah. Okay. This is also from Melinda. I was just wondering if there's anything about like the whole mindset module that would apply to men specifically. Do you think there's a difference in how men and women should approach the whole module or not?
I don't think so. Of course, your needs are different, but that's not necessarily gender related. It's just individual. So each individual's needs are different as far as your journey with PCS. But I wouldn't say that there's specific way to approach it for women versus men.
Okay, thank you.
Okay, Nikki, we'll turn it back over to you.
Yeah,
Yeah.
don't hands.
We've got a few questions in the comments, and then if we have time, I do have a list of a couple people who do have questions also.
Sure, let's go for it.
So first question is, I'm 45, male, did the Concussion Fix diet, but still struggling with IBS. I've been struggling with it for at least 20 years, always worse before I leave the house or any place. I leave the house or go any place. I need to go to the washroom. It's more of diarrhea versus constipation. I have gotten a little better years ago. The PCS made it worse. I thought it was getting at least back to my normal, but after a weird virus a couple months ago, it has gotten worse again. I have never followed the Food Maps diet though. Should I try that? My wife picked up probiotics a year ago for me. I took them but never noticed a big difference after taking them for about 3 months and told her not to buy anymore as they are expensive if I don't see a difference. I do lemon water every morning still.
I feel like I remember this question from last week. I don't know if we had a chance to get to it, but
Yeah, we didn't. It's the question from last week.
yeah. Okay, perfect. Okay, so we've talked about this over and over again. Any sort of trauma, concussion qualifies for that. It will aggravate underlying issues, and IBS is a classic nervous system meets your digestive system issue. Now, into that is also baked in imbalances in your microbiome. And so that's where the foods that you eat can feed bacteria, can feed fungus or candida that's present that could also be overgrowing. Now, these are opportunistic things that kind of come up. So that's kind of the three things with IBS to remember. So one of them is there any sort of imbalance in the microbiome? Things like antibiotics and poor diet and things like that can contribute to that. Even like a viral infection can modify your microbiome, and then you can have symptoms after that. The next thing is food sensitivities and inflammation directly related to food proteins. So this is not allergy, but this is like a food sensitivity piece. And the third piece is the gut-brain axis dysfunction. So your vagus nerve, we know stress and anxiety are huge triggers, well-known research-based triggers for IBS. So when anyone presents with IBS, both with PCS or even before PCS, we're considering those three things. So hopefully that gives the person that asked the question of some idea of what they should be thinking about and working on. Going through the CFix program, including the diet section and especially the mindfulness section, kind of addresses two of those three things, at least to some degree. Usually that should help in some way. If it doesn't, meaning the mindfulness is looked at and then you really cut out a lot of the major triggers. So we're talking about gluten, we're talking about sugar, we're talking about alcohol. Those are three major triggers. then you should, just to finish up on the nutritional side, you should do some sort of investigation on the food sensitivity component. Food sensitivities are like allergies in the sense that your body can't handle the protein, but they're different than the typical kind of like environmental allergies or peanut allergies, that they're not fast acting. So they're slow acting, and they come on after hours and days, and it takes days and weeks to resolve. So it's much harder to figure out what's causing it and the kind of cause and effect here. Unlike, you eat a piece of peanut or a nut and your tongue gets swollen or itchy, that's very obvious. So that's the first step that you should be looking at. The diet, like the PCS diet, is a good starting point. Then if that doesn't help at all, then you start looking at things like the FODMAPs diet. At this point, what my strong recommendation would be is that you've kind of done, I would say, the foundations of the DIY, do it yourself. And now you're looking for some professional help, because to identify the imbalance of the microbiome, it requires testing, and there's different types of testing that can be helpful. The implementation of the FODMAPs diet can be done by yourself, but it is challenging, and sometimes a lot of people have questions like, what shouldn't I evolve? I generally start with avoiding food sensitivities first. I do some blood testing because it's the most easy access to what foods you should be avoiding, instead of just like, let's avoid all these major triggers. That's a really strict diet. That's hard to do. And then we progress to microbiome testing, which is usually the most expensive, and it also is the one that requires usually the most intervention. So hopefully that makes sense. There's half of what the stuff you can start on. Is that making any difference? If, as you said, a probiotic does not make any difference, that does not mean you do or don't have IBS. That just means you may not have the microbiome problem. You may have one of the other ones that I mentioned. So hopefully that gives some insight on how you maybe should proceed.
I can just picture maybe this question coming up for the person: where to go for the food sensitivity testing that you mentioned, and the microbiome testing and other testing. Like, would any naturopath be able to do that, or who would be the best person to go to for those different testings?
Yeah, you're absolutely right. A naturopathic doctor is probably the best one position for that. There are some functional medicine doctors, that could be a medical doctor, could be a chiro, that really understand this and have a focus. Anybody, just like Dr. Cam says, like at this point, when you've narrowed it down, like your gut's the problem or your neck's the problem, you don't need like a concussion specialist at this point. You need someone that like really understands the gut, or in the case of a neck, you need somebody that's an expert in neck and headaches. They don't have to be like on Dr. Cam's website or on our website that's like there as the official clinic. Now you're really zeroing in on what your specific factors are. One other thing I would mention that just kind of came up as you were asked that question, I'm looking at the question, and this person mentioned they do lemon water in the morning. So there are some simple things that a person can try to see if that they make a difference. For example, lemon water in the morning, apple cider vinegar, or bitters, which are available through most health food stores. These are kind of, I would say, entry level, like can we support your body's digestive capacity? I've had patients tell me that cutting out sugar and taking out a teaspoon of apple cider vinegar in the morning in some warm water has been like a game changer for their digestive symptoms. So something as simple as that can be helpful, and it's a good place to start. So there are some simple things to do. Lemon water and apple cider vinegar and bitters are hit and miss. So if you try them, that doesn't mean that you've like solved the digestive function capacity problem. No, that you could still have foods that you're eating that could be inflammatory. But your family doctor will not be able to do the testing you asked, Nikki. So that is something to keep in mind. And they oftentimes will either refer you to a gastro, or they'll just say, you have IBS, deal with it. Here's Concerta. If you're constipated or have diarrhea, we can give you medication for that. But they really don't do the troubleshooting I just mentioned.
It's such a complex picture. It's sort of this sense of, like we were talking about earlier, each of these different buckets require so much concentration and effort, and it can be really discouraging. But just thinking about choosing each bucket as it's a priority for you and then focusing on it for a while. It's okay to stay in one area. I think sometimes when someone has something like IBS, or there's underlying mental health, I find that it can feel so overwhelming for people because it's hard to address all of the things. So you don't want to just try to focus on the umbrella. Choose a bucket to focus on for a while, and that's okay. Normalize that it's okay to stay there, especially in the case of IBS. I just
Yeah.
want to add that in because it's tough. It's going to take a couple months to sort things out, especially if you're doing an elimination diet or testing. But see if you can normalize for yourself, for everyone listening, that it's okay to stay there for a while. You don't have to get on to the next part of the Concussion Fix program if you notice you're having one of these issues that are a little bit more complex. Take the time to figure that out, and you'll do so much better for focusing on that one aspect for a little while.
And that actually made me think of a question for when someone is trying some of these, like the low-hanging fruit DIY things first. How long should someone actually try them before they then go to the specialist?
Yeah.
Because a lot of people will come into the program, they're like, oh, I did this for 3 days. Okay, well, 3 days isn't quite a long time to really get into the mindfulness practice or into the diet, right? Is there like a time frame that's ideal before you really then go to the next steps?
Yeah, I mean, Melinda, I probably think you'd agree, but generally a month or two, like 4 weeks is a minimum, 8 weeks is ideal. We say this for the diet. We say this if you're trying any new practice. Why? Because we know evidence shows that it takes about somewhere between 40 and 60 days to create a new habit, and you are basically reprogramming your body's not just habits but also physiology. And so it takes some time for those changes to kind of be incorporated and then the benefits to really show up. Sometimes the benefits are immediate, and within a first couple days and weeks, I've seen patients that really are hyper responders to diet changes have very positive results. We see them in the course all the time. But then there's the people that are like, you know what, I had to follow the diet for about 3, 4, 5, 6 weeks, somewhere around the 6-week mark. Now I'm starting to notice that my symptoms are getting better. This is the third of that are kind of like, I would say, slow responders, but they're helping your inflammatory burden, and that doesn't change right away. And then, of course, there's a third of people that you can take all the apple cider vinegar and bitters in the world that you want, and they're not going to respond. And diet is not really their main issue. Sometimes in these more complex cases, Melinda, that's where they need that extra support, even with medications. Sometimes I will prescribe medications and some very targeted herbs to clean out some of the imbalanced microbiome. That is not going to be changed by diet, no matter how many pieces of broccoli you might consume to think that that's helpful. I really think the point I was going to make here to kind of close up this question is, how do I know I need extra help? I think if you've tried those basic things for 2 months, we've detailed a lot of them in the course. In the Concussion Fix vagus nerve handout, there is on the back side of it, there is, I don't know if it's a front or back, there are some general recommendations for digestive support, because we believe that these basic things should be helpful, like not eating when you're distracted, not over drinking any beverage when you're eating to just fill yourself up and create a greater chance of things like bloating and indigestion. You're going to combine foods properly, in the sense of, like, you're not eating a ton of starchy foods with a ton of protein. Like, think of like meat and potatoes are really hard to digest, because now you have two really hard things on your digestive system at the same time, even though that's like the standard thing for almost every single main meal. Little things like that, if they don't really change after, again, that first 2 months, that's when you're seeking help. Just in the same way that we say, if your neck is not getting better after doing the basic things, you're going to need to find somebody that's going to help work on that neck. And this is where a naturopathic doctor, functional medicine doctors are so helpful. And I would even say, and this is where you come in, Melinda, I would even say, in the terms of IBS, mindfulness and psychology is incredibly important as well. There's lots of research that I've seen showing mindfulness interventions are as effective as the standard of care for the pharmaceutical options for IBS. So there's a huge mind-body connection in IBS.
Absolutely, that gut-brain axis, right? That sense of mind-body connection, like you said, it's really important, and that's why we have that foundational component as addressing our mindset, our mental health. If we're experiencing digestive upset, any kind of GI issue, I think it's safe to say that we probably have some level of stress. Most of the time, it's safe to say anyone with PCS is experiencing some level of chronic stress. Chronic stress is what kind of causes all these underlying dysfunctions in our body systems. So, we have it as the foundational element for a reason. I know the literature cites mindfulness a lot as sort of that catchphrase, but there are so many different subtleties within that we've outlined in the program that, as we were describing in the last question, the skill of focused attention, right? When we're able to focus on one aspect of our experience, it signals our nervous system to go into a parasympathetic state. It balances things out. Things start to function better, right? It's this sense of how do we start to support and balance our nervous system. And that is sort of that key to managing stress, and directly linked, as we were using IBS as an example. So absolutely, I agree.
Great. All right, let's move on to the next question. I have had problems since my wreck in July 2024. I can personally see improvements, and I'm now in PT with a specialist. The biggest issue is people not believing anything is wrong with me. I'm tired of defending myself by stating me symptoms. I was wondering what to say to these people, even if the doctors have a hard time believing me until they saw me having symptoms. And I know we've talked about this too in past live events. Melinda, if you want to maybe start with this one.
Absolutely. I mean, I think one of the things that happens with any chronic health condition is that sense of being passed around from provider to provider, or seeing multiple different providers and feeling like no one's really getting it, which is not necessarily something that we need, but it feels like it at the time, right? This sense of, I'm not being understood. Why doesn't anyone believe me? We're looking for that external reassurance from others to say, hey, how can you help me? So, one of the things I always work on with clients in my practice is, if somebody doesn't understand or it doesn't feel like they're able to support you, that's okay. Find another way to resource yourself or seek a different provider. Not everybody's going to understand your symptoms. Oftentimes, one of the trends I see frequently is with specialists. So if you get in to see a specialist and they're within their scope of practice, they're not able to find something wrong or find something that they can support you with, this can be really crushing for people because they're waiting for this appointment, especially here in Canada where the wait lists are long. We're waiting for that appointment and really just waiting to get an answer. And if that individual or that specialist doesn't have an answer, it can feel really mentally and emotionally crushing, right? It adds to our suffering. So one of the things we talk about in the building resilience module of our program is this sense of, okay, if something doesn't work out, or we can recognize and bring awareness to when we've put a lot of eggs in one basket, it can feel less impactful and allow us to feel a little bit more resilient to move on to different types of support that can be helpful. Almost, I like to use that sense of, can we use it almost as an opportunity for growth? This person can't help me understand or what's going on in my body, or maybe it's outside of their scope of practice. Can we look at it as, actually, that rules out all of their specialty area? That's a positive. I'm not having an issue in that particular area. Now I can move on to the next area that might be more targeted for what I'm experiencing. So sometimes, to wrap that up, if it wasn't making clear sense, is this sense of our mindset. What's our mindset towards these disappointments that you're likely to experience when you're living with chronic health conditions? Because there are going to be disappointments from providers who can't help you or validate your experience. So instead of seeing that as, oh my gosh, no one can validate me, that can actually lead to a very unhelpful mental health spiral. I see it all the time in my practice. So the support or the perspective that can be helpful is, this door is closed. I can feel maybe reassured that whatever area of specialty that individual focuses on was not my issue. Can I now move on to the next one? There's so many different buckets to explore with PCS. So try not to feel discouraged when you might come up empty-handed with some practitioners that might not, whether they don't have the expertise in PCS or they may not be able to help you, that it's okay. And I know Dr. Paul, you'll probably have lots to say around, the sense of finding the right provider. So even if it's just someone who might not have that expertise in concussion care, and that's also an important consideration that I know, Dr. Paul, you know a lot about.
Yeah, I think you covered it, Melinda, really well. I just want to echo the sense of frustration. This is probably the biggest thing that I noticed that my patients and members in the program, especially early on in their journey, I want to reassure you that this is a normal response, that as a person finds their way, and this is one of the reasons we started the Concussion Fix program in the first place, is because this is a huge gap in the medical system, is that patients get a concussion, they're told by all these specialists, everything is normal, and go and live your life. And things will get better in time, and they haven't, and they're not. And this is obviously this gap we're trying to fill. And I think this is the first step that we're identifying with patients that are struggling. But through the information you get in the program, people are now able to make more educated decisions. And we've done a number of lives on this topic where we've actually detailed how to find the right team. So if Nikki can put those, if they haven't been put already, into the chat, they are really helpful for people to understand from an expectation perspective. If you're going to see a neurologist and you're hoping that they're going to tell you why you've had these chronic headaches for the last 6 months, they may not be able to tell you that. And it's partly about expectations. Partly it also is that there's lack of training, and the default mode is, if it doesn't fit into their, I can see it on an MRI, or I can somehow visualize it or test it, it usually gets thrown into it's a psychological issue. And that really irritates people when they hear that. And I actually push back on with both patients and providers on that, where there often is underlying psychology aspects, and Melinda talks about the mindset of recovery. And so just the fact that you've had this frustration, and then of course you can even sense it from the question, this is actually going to be holding you back in finding the right team, and also finding the way forward for you right now. Because we know anxiety, we know frustration, we know anger, we know ongoing insurance issues, litigation. These are all major evidence-based obstacles. Mm-hmm. And so once we realize that, then we start thinking about the conventional and the other alternative healthcare options as not as the main solutions, but we may have to do this ourselves partly, and then advocate to find the right providers that work for us, because we've identified the underlying issues. Because if you come to a provider and say, who did I have recently? There's one really good case. Something about like, I think it was someone from last week. So maybe go listen to that. It was like a peculiar symptom that someone was like, I have like ringing in my ears or clicking, something like that. Melinda, do you remember there was a patient saying?
Question.
It was something. It was a pressure in the ears or something like that. Mm. And they went to the specialist saying the concussion caused this like pressure in the ears, and they're like, no, that doesn't really work. That doesn't make sense. And that's because the person came in with saying, hey, my concussion caused this, when it could have absolutely triggered it. But the way to approach it is, I have this symptom and I'm going to the right provider that understands this. And as part of the health history, I'm going to say, you know what, it started after I hit my head. Mm-hmm. And let them come to that conclusion. Because right away, as soon as a person makes concussion caused all this stuff, it messed up my hormones, they're going to be like, no, that doesn't make sense. That doesn't compute. We know it does, but you have to almost approach it in the right way and incept them to make the right decision.
Yeah, and the client then feels dismissed right off the bat, and you kind of lose that whole sense of support. I just wanted to capitalize on one of the things you said, Dr. Paul, because I think it's just maybe a helpful way to wrap up this question, is that sense of, here in the program, we've worked hard to provide you with a framework so that you don't feel alone in your journey, right? We've provided you with this framework of this is why some specialists can't help you, or this is why some people aren't going to get it. And maybe not worry so much about being dismissed by some providers, because there is a way through this, right? This is sort of this whole foundation of why we brought this program to life, is this sense of when you don't feel that you can take on all of this yourself, there's this program here. We've designed it in order to provide you with a loose framework of how you can go through to make sure you get the proper support team. So that was that piece you mentioned a little while ago, Dr. Paul, that I think is really brilliant, the sense of it's okay to not know how to support yourself. No one's expecting you to know how to support yourself through something like PCS. But if you have a framework, then you're not going to feel knocked down each time one specialist you see doesn't pan out. It's more this sense of, okay, I've got this framework to follow step by step. I don't have to rush through it. It is effective. We know it's helping and supporting people. It's also a little bit of a way for you to have members in this program to have someone to lean on a little bit. You lean on us for this framework that we know can be really helpful and help you peel back all these layers of the onion of PCS, because it is so complex and no one is expecting you to be able to do that yourself, but not to fall short when one specialist can't support you in the way you're hoping, right? So back to that expectation piece you mentioned.
Yeah,
Great.
great way to wrap up.
Yeah, and so I put a few seminars from the past, from Micropractice for Resilience that Melinda did, social support systems for survivors that Melinda did, supporting your loved ones with PCS that Dr. Marshall did, which that one is available on YouTube also, so anyone, any loved ones can watch it. And then for the medical system, tips to navigate the medical system with more ease that Melinda did in July 2024, and getting the best from the medical system part 1 and 2 from Dr. Hrkal in May of 2022. So just a few seminars,
question.
right? That touch on that. All right. Next question is, I've been researching on parasite cleanses. A lot of places in the world do them routinely, but US doesn't. I saw it can help with some health issues. My naturopath is okay with me doing it, but she doesn't specialize in PCS. I know keeping elimination pathways open is important. Dr. Hrkal, you talked about the 4 elimination pathways a bit ago. Was that in a seminar? Lymphatic, urine, what are the other 2? I like herbs and teas. Any teas that you would recommend to help them stay open and flow?
Yeah, we want to be open and flowing. So that's a good question, because online, if you ever just kind of start going into the weeds on these kind of like alternative health influencers, detoxes, cleanses are pretty popular. Couple things to say about this. Number one, a lot of this is not evidence-based on what's published. And we really try to anchor ourselves in what's evidence-based first. And this is me talking as a naturopathic doctor that has been exposed to a lot of traditional ways of healing, both in Europe as well as in North America. So that's the starting point, because we have to look at, if we're in this course talking about PCS and I'm looking to do some sort of cleanse to address my PCS, I think you'll be disappointed. I think that's where the evidence really, really doesn't support that. However, if you're made progress in the course and you're addressing a lot of the underlying issues, and you're working with a healthcare provider, which it sounds like this person is doing, and now you're looking to optimize your health. Now you're looking to maybe address some residual issues, and you've identified some particular things that may benefit from detox. I had a patient just yesterday that I've been working with for a long time, has had some chronic fatigue problems, and we did testing years ago that found she was sensitive to mold. Now, she said I had no mold issues at all, because we first look at exposure. So that kind of got put on the back burner. I saw her yesterday for the first time in a year and said, Dr. Paul, I found mold in my apartment that was next door that was seeping in. And then there's mold in her father's house, which she's living in now. And now this is making her think that this could be an issue. It could have been an issue for years and could be her present issue that's holding her back. So this is a good example of a situation where we're no longer dealing with PCS in the kind of first level mindset, nutrition, and movement. Now we're looking at what are some things that are holding you back. So I would say the tier 2 things, like something like, digestive dysfunction that was mentioned earlier with IBS. So there's some detoxification practices like using binders, using things like clay that's going to detox some of the things from your digestive tract. The same thing's applicable to mold. So there are certain situations, absolutely, I think detoxification, if we're going to use that word in quotation marks, is helpful. But going in just to grab a parasite cleanse kit from the health food store and hoping that it's going to somehow help your PCS symptoms, that I don't think is a good idea, nor do I think it's anywhere near to be evidence-based. We look at the research that's published, but we also look at the way bodies function and pathology and what we can do to address that. And that the research doesn't always fully get that. That's where you need a clinician to look at a person and work with that person to identify their underlying issues. And we use an evidence-informed approach, but sometimes we're going to do things that are outside the box because physiology and your case dictates that. So hopefully that kind of clarifies things. I would be careful doing any sort of detoxes willy-nilly. You want to do the lymphatic system, the liver system, the digestive system, and the kidney system. These are the 4 main detox pathways in the body. And when I say detox, it's what your body is normally doing every second of the day. It's putting in nutrients and it's eliminating wastes. Sometimes because of stress, poor diet, medications, poor lifestyles, all the things that kind of contribute to having suboptimal health, it can make that nutrient delivery system and the waste elimination system sluggish. So, AKA detoxification. I just saw a paper yesterday about saunas showing that people that use saunas, which is one of the most quintessential detox therapies, had a decreased chance of dying compared to people that didn't, substantially lower. So detox is absolutely foundational. There's some really evidence-based techniques. There's some also weird, wacky, and quacky stuff out there. I'd be cautious of that.
I like that. Wacky and quacky.
Yeah. Also, and do you remember, was that in the, I just had it, Healing Concussion by Optimizing the Gut-Brain Microbiome, where you talked about those 4 pathways? Do you remember?
I think that does ring a bell, Nikki. I can't quote me on that, but I think that's usually where I would address that. When we've talked about the lymphatic system, that's part of the lymphatic system. So, I mean, it makes sense to, be hydrated and do things that are eliminating. But as I detailed in that particular presentation, we're not quite at the point where you can say this herb detoxes the brain like that. We're not quite there yet to say that, but we know that when you get good sleep, your brain is lymphatic system is going to function. When you're exercising, your blood flow in your lymphatic system is going to function better. So the foundational things are promoting detox at all times.
Yeah, perfect. And do you know of like any herbs or teas they had asked to help with keep things flowing?
So when it comes to the lymphatic system, there's a number of herbs that have a lot of traditional use when it is used a lot in European medical circles. So traditional European medical, so German, Belgian, they were using these, like, they're called complex homeopathic remedies, where they are focused on eliminating those 3 or 4 pathways I just mentioned. I'm not even going to there's not a one tea or a one herb that I'm like, you got to be on this because it's like really helpful on detoxification. It's like this combination of a whole bunch of these herbs, and a lot of those herbs, if you search them in like standard Western, even botanical medicine literature, they don't really have any evidence supporting them, unfortunately. So it's hard to kind of hang your hat on them.
And I wanted to add in there, like, be mindful of the trends. I remember a few years ago, there was like some rosehip trend detox. That was just a ton of supplements that basically made you have to use the washroom constantly for weeks on end. And they're like, that's going to cure all your problems. So be mindful of media and sort of the trends that can show up that, might not be safe for you, for someone who has PCS, right? You're sensitive, and any added stress to your nervous system can really flare things up. So always best to, seek some support with a mental health professional or a naturopath or, whatever professional it is you're seeing for these types of things in order to support you in the best way that you can. You don't want to do any of these, trendy things that are just going to create a
Right.
setback. Yeah.
And that piggybacks with question in the chat, where she talked about this targeted nutritional analysis that looked at sensitivities and hormones. She mentioned magnetic analysis. We're starting to get into the bit of the weird and wacky here at this point. And then there's like a whole list of supplements that are associated with that. I mean, this is where I get a little bit frustrated because literally anybody with a nutritionist degree can go and buy one of these machines and set themselves up and start just testing people, and it gives them a report of all these different things, and then the culmination ends up being that here you need to take 10 supplements. And so it ends up being like a pretty lucrative business proposition, but at the end of the day, I think this is where you have a regulated, trained medical professional that's able to, be open-minded enough to understand physiology, like functional medicine, respects mindfulness and respects the mindset aspect of things and exercise, but is not going to go down the route of, we're not going to tell you what it is, we're just going to give you all this stuff, and it ends up being very expensive without a lot of transparency. That's where I think people can kind of get duped a bit.
Yeah. Especially when you're just vulnerable and you really just want an answer. You're like, I'll try anything, I'll do anything. So it's just, this is your gentle reminder to outsmart the marketing world.
Not to say there isn't something to it, there probably is, but it's like, it's in the way that it's used, Melinda, that I find it sometimes a little more sketchy, is that, so we can use some diagnostic tools that are outside the box, let's say. We obviously use the standard ones, but then there's some ones that might give you some, but it's a piece of the puzzle. My issue is that when you put yourself on this machine, you hold this rod, it gives you, they do all these points in your body and they say, you have all these issues. And that's the only assessment tool. Like you're 100% putting your eggs all in that basket. That's the trouble.
Yeah. Be mindful of someone who potentially offers a cure, right? That's not really not always the most accurate approach for something complex like PCS.
Yeah. So I responded to that, and I've responded in the chat too for you there. Okay. Anything else, Nikki?
This one, just one last one. I think it's a little bit of an easier one. Are there any non-antibiotic treatments that are effective for UTI? Very sensitive to antibiotics and like to avoid them if possible. Can't use cranberry as I have high urine oxalate and kidney stones.
Yeah, there are. This is, again, what a naturopathic doctor would guide you on which ones, because again, this is the perfect nuance of like almost every single natural health product on the market has cranberry plus something in it. I would point you in two directions. Number one, probiotics. So, urinary tract infections, trying to figure out why are they happening. Is it after intercourse? Is it after swimming? Is it a chronic vaginal microbiome problem? Like there's a whole bunch of reasons why this can happen. Yesterday I saw a patient that it was estrogen deficiency and the changes in the mucosal membrane of the vagina and the urinary tract can predispose you to more urinary tract infections. So there's finding out the reason. It's not as simple as saying, are there any other options? From a conventional perspective, it's like they keep throwing antibiotics at you. I'm glad that you're identifying that's not a good idea to do. Or, yes, if you really need it, but, has the root cause been identified if possible? Probiotics is number one to think about. Number two, I've already mentioned the hormone piece, so that could be an issue with estrogen deficiency. And number three, there's a substance called D-mannose. It's a sugar. It's not like glucose. It's not a detrimental sugar, but it helps kind of protect your mucous membrane from the E. coli, which is a common cause of the UTI, to stick to the walls. Also, think about testing your partner if it's worse after sexual interactions, because that can also be something that continues to reinfect. It changes the flora of the vaginal tract, but it also can be like a constant source of reinfection. Something to think about. Okay, I think that's it. Oh, you're muted
I
there.
was still muted. I think it's a great spot to wrap up today's Q&A. So thank you everyone for coming on, and hope everyone has a fantastic day. Bye everyone.
See you later. Bye.
Thank you for tuning in to the Concussion Fix Podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.